It's a drug initially made for those with certain types of arthritis, but now the Manitoba government is also compensating people who use it for relief from psoriasis. First, a warning though, we're going to show you some pictures which you may find disturbing. Now, we're going to also get two views about how the drug called Enbrel is a big help for psoriasis patients. To my immediate right, Winnipeg dermatologist Dr. Jack Toole, and a patient of his, Ken Benyaris, a patient with psoriasis. But first, let's start with Dr. Toole. What is psoriasis?
Psoriasis is an inflammatory condition in which the skin grows much faster than it normally would. So you end up with a thick, red, scaly skin which is imperfectly formed.
Okay, we have some pictures of that now, and maybe you can take us through this because first of all, there you go on the hands. Is it that bad?
Sure, it can occur anywhere in the body. It can be anything from a few spots in the scalp to basically a totally devastating rash that covers 90% of the body.
Ooh. And why is there too much skin?
Well, the skin normally renews itself about once a month, and when you have psoriasis, your skin renews itself every 2 to 4 days. And we initially thought this was mainly a result of just the skin growing too fast, but now we've learned that actually it results from the immune system misfiring.
Oh, I see. And so what? It sort of hastens the growth of the skin?
Yeah, it's a bit of a complex thing, but the immune system is the organ of our body which protects us from infection and cancer. Oh. And when it misfires, it creates all kinds of problems, one of which is psoriasis, and other diseases such as arthritis result as well.
All right, well, I want to talk to your patient if we could, Ken Benyaris. You had, or still have, psoriasis. Yes. How bad was it for you?
It was pretty bad. At one point I was about 70% covered. I was diagnosed with psoriasis at age 21.
And was it all over right away?
Yes. After I had a throat infection, and you know what? A week later, it just spread like wildfire. Oh. And I didn't know what to do, so I went to see Dr. Toole.
What effect did it have on your life?
It was very difficult. You know, enjoying the simple things like walking your dog. In the summer, I always have to cover up. Getting a haircut was difficult because I had it on my scalp too.
And so why was it difficult though? Did it hurt?
Yes, and the itching was unbearable.
Now, we saw those pictures earlier, and we'd like to bring them up again, but was it ever as bad for you as it appears now in these pictures?
Well, I was pretty lucky. I didn't have it in places where people can see it. I was able to cover it up. But mostly it was in my back and my torso.
Oh man! It's okay. So it hurt. It itched.
Yes.
You tried a whole number of creams and things. I take.
Yes. Also, it's just also you know, you feel depressed about it because you know there's really very little that you can do in terms of treatment when I was first diagnosed.
All right. What effect has this Enbrel had on you?
It's great. I felt like my life has been given back to me. I've been able to, wear shorts for the first time in a number of years.
Now, this is a needle pen that I use for my psoriatic arthritis, which means it's related to psoriasis. But you do not use this, but you take the same dosage, 50 milligrams.
That's correct.
All right. So how do you take it?
I have a different one. It's just a pre-filled syringes. I have to inject it in my stomach and on my torso.
Once a week?
Yes, once a week.
Dr. Toole, this is a pretty expensive drug. What effect do you think it'll have on patients? Because now it's covered by Manitoba Health.
Well, first of all, it's covered for people with the severe forms of psoriasis. Psoriasis affects 2 to 3% of the population, and probably 30% of those have quite severe psoriasis. So I think it'll be a tremendous advantage for these patients and improve their quality of life and allow them to enjoy life before they've kind of suffered in silence.
Well, that's a tremendous thing. It's a big deal because I know each shot that I take costs more than $400, and I take it once a week, as this can. So it's a big deal. Thank you very much for coming in and telling us about it. I appreciate that.
Brian.
Dr. Jack Toole, dermatologist in Winnipeg, and a patient of his, Ken Benyaris. Please stay with us. We've got a lot more BT coming up after the break.